Welcome to Perspectives, a special presentation of the Power of the Patient Project. Today's guest is Dr. Soma Mandal. And now, here is your host, Charlotte Grinnell.
Hello, I'm Charlotte Grinnell, and welcome to Perspectives presented by the Power of the Patient Project. My guest today is Dr. Soma Mandal, widely regarded as one of America's top physicians in midlife women's health. Dr. Soma Mandal is a board-certified internist who has helped thousands of women to successfully navigate menopause and reinvent themselves along the way. She earned her MD at New York University School of Medicine and did a prestigious research fellowship at Oxford University in England. Dr. Mandal brings a fresh perspective to the topic of menopause, particularly for women of color. Welcome, Dr. Mandal. I'm so excited to get started with this topic.
Thanks for having me, Charlotte.
Yeah, so first, many believe that women's health has not been given enough attention over the past decade. Tell us about your focus on menopause, particularly for women of color, and why did you choose this focus in your practice?
Yes, that's a great question. So I'm a board-certified internist by training, and I came to appreciate and love women's health further into my career when I developed my own practice, which was in New York City at that time. And I noticed that, I just attracted a lot of women patients, and I still do, obviously. And one of the great things about being an internist is that, you basically get to take care of the total health of a person. And so my definition of women's health, for my patients at least, is to address everything that, everything as it pertains to a woman's health, which can be her brain health, her heart health, not just her gynecologic issues.
Yeah, definitely. That's what kind of led you to this specific niche, I guess, of menopause and kind of that area of women's health.
Yeah, so I basically, throughout my training and my practice, for the past 20 years, I've noticed that, through the various stages of women's lives, whether it's puberty, meaning adolescence, going, into childbirth and the various stages like, breastfeeding and stuff that are associated with that women tend to be very knowledgeable, and there's a lot of information pertaining to their health when it comes to those stages. But I've noticed that when it comes to menopause and the stages associated with that a lot of my patients don't know what's happening to their own bodies. And they're not familiar with some of the risks and other things that they should be familiar with, at that particular stage of life. So even though, yes, I do, talk about menopause, and I've written a book about menopause, it's more to address that particular stage of life where women should be focusing on so many things, about their health, like their heart health, focusing on their bone health to make sure they don't have osteoporosis. There are risks of dementia as you get older. So I help them guide through that to be as preventative as possible to lower their risks for other types of disease that they can get as they get older and as they go through menopause.
Yeah, and the book that you mentioned is called Dear Menopause, I Do Not Fear You. And I read the reviews of your book, and they're overwhelmingly positive. And so congratulations on that. And I guess I was kind of wondering, how is your approach to treating menopause perhaps different from your colleagues' approach? And, how did you come up with this approach over the years?
So I think one of the things I always tell my patients is that, for them not to expect a miracle pill or a miracle solution in one, session, that it would take time to learn about, what they're going through. And sometimes that can take 2 or 3 visits before I can make suggestions as to what they're experiencing. And if they understand that and they're willing to kind of go along with me, a lot of it is just listening giving them the time to express themselves so that they can, tell me what's going on. I find that a lot of women, unfortunately, there's still a lot of stigma and shame when it comes to menopause, and just being able to talk about it is often an outlet for them, and they feel a lot better.
Yeah, I mean, that's so great to have, to be able to have a comfortable conversation about it, because there is so much stigma and uncomfortableness that kind of goes around that topic. And so you kind of talked about your approach and how you help the patients to feel comfortable, but what are kind of your advice for women who are watching this to make it easier and more pleasant for them? Like, how can they kind of approach their meetings with their appointments with you? Because it is such a difficult, condition to go through.
Yeah. So I think the first thing, to realize, and, since I'm a woman, I always tell them, like, if we're lucky enough, if we're fortunate enough to live a long life, we will all be going through this. So you're not alone in this. The symptoms of menopause can be very variable from, woman to woman. And so, I always say that, you shouldn't have to feel like you're in this alone, that you're the only one going through it. And, if you are able to talk about what it is that you're experiencing, then that's where the process starts, where, I or we, sometimes it's a team of doctors or, people, we can help you through this. So a lot of it is giving them the comfort, also asserting, that what they're going through is a valid thing, that it's not all in their minds.
Yeah, and in your opinion, is the treatment of women's health improving, or is it still not getting the attention it needs in the medical community? And also kind of going off what you just said, where you said, there is kind of that stigma around it, and the patients themselves can work on it, but what can, outside of them, what do you think needs to be done in the treatment of women's health overall to kind of improve that stigma beyond just the patients individually doing it themselves?
Yeah. So, unfortunately, there are, disparities in health care when it comes to women.
Mm-hmm.
I can give you examples of, let's say, the different types of cancer. Unfortunately, like when you compare the funding that goes into breast cancer versus other types of women's cancers like endometrial cancer or cervical cancer, there's a lot more funding that goes towards breast cancer versus, those two types of cancers. And the reason being is that, again, that stigma factor comes up, where, women might be ashamed of being diagnosed with, cervical cancer. And there are other types of cancers where, there is a stigma as well. Whereas breast cancer, the survival rates are better than other cancers. And there's a lot more funding and research because of it, because women survive. The survival rates are better, and they're able to, ask for that support from different groups. So that's an example of where there's a discrepancy in healthcare. And then more directly, I'll give you an example of heart disease, for example. The way we're trained in medicine, at least as I was trained, I can't comment on now. The classic symptoms of a heart attack of left-sided chest pain, you're sweating, you're nauseous, you're throwing up, the pain radiates down your arm. Well, women don't necessarily present that way. Our makeup is different, and we can have different types of symptoms when it comes to heart disease, when we're having heart attacks. And there are often times when these symptoms are not recognized or well understood. And, it's felt that because, we have estrogen, that our risk for heart disease is low, when in fact, and this is where menopause comes into play, it is known that 5 years after menopause, the risks for heart disease for women go up.
Oh,
So these are all discrepancies, that are in play, and it's important to know these things to equalize the playing field, to make to level out the care that women receive.
yeah, definitely. And in your opinion, do you think that, having conversations with, I guess I was going to say women, but kind of everyone from a young age to kind of help educate them about menopause throughout their life so that it's not something that once they get older, it's kind of,
Mhm.
they learn all about it at once. Do you think that it would be helpful for, parents and educators and, in health classes and stuff that they have more of a focus on that so that it's not such a, taboo topic when it does eventually happen to women? I think it's
I think
important
it's
that,
great.
yeah,
Yeah, I think that's absolutely great. I don't know how much of it would penetrate,
yeah,
25-year-old woman who's, looking forward to life. But I
yeah,
do think, putting that information out there, is fabulous. That being said, I think the best thing, for women to do is to make sure they have a doctor, a primary care physician that listens to them,
mhm,
that, is aware of all these things, that they can guide them through all this. No one person is expected to know all this, and a good doctor can, help guide you through it and provide not just the preventative care, but obviously provide any care that you need if you develop any illnesses.
yeah, okay, that makes a lot of sense. And I think, we've talked about a lot of different things, but if there was one main thing like a message you're trying to get across, you wanted to get across in your book, or just like a main message that you mostly want viewers to know when it comes around menopause, do you have like a specific thing that you would want to say, or is there just, I mean, there's probably so many things that you would want to
Yeah.
get across, but if there's like
Yeah.
a main, message.
Yeah, so, I mean, it depends on, what it is, what you're trying to address. I think one message I would, try to share with all my women patients is that I encourage them not to give up hope and not feel like, that there's nothing available to them if they are suffering from some of the, the symptoms that can be very debilitating
Yeah.
when it comes to menopause. Um, Another important message I would, share with patients is, with menopause, to be aware of other things that come, and some of them are age related and some of them are hormonally related in terms of their risks for heart disease and dementia and breast cancer. All these things are really important to know. And as I mentioned, a good primary care physician can help navigate that for a patient.
Yeah. Okay. Yeah. I mean, this has been such an interesting conversation, and I think that I've definitely learned a lot. I think that there's, not a lot that I know about menopause, and so I think that it's just such an important conversation to have and to learn about at this age and any age. I think everyone should kind of be a little bit more informed about it. So, thank you so much for coming on here and explaining it to me and all the viewers. It's really important what you're doing, and I appreciate it a lot.
Thank you so much. Thanks for having me.